Hello everyone, today is June the 9th. I'm Dr. Adam London, Director of the Kent County Health Department, here for today's COVID-19 update. Across the state of Michigan, it's reported there are 58,999 total cases of COVID-19. That's an increase of 129 over the previous day's number, and 5,673 deaths in total statewide, an increase of 17 over the previous day. Here in Kent County, yesterday's reported number was 3,954. That was an increase of only 13 cases, and that's the lowest number of new cases reported in a day that we've had in quite some time, over 2 months. That's very encouraging. Our numbers continue to trend downward, and we hope that continues. We did have 3 deaths reported yesterday, unfortunately, and that brings that total to 103 as of yesterday's reported number. So there was some confusing information out of the World Health Organization yesterday. And I think a lot of us were surprised by the headline that said that asymptomatic cases of COVID-19 are very low risk to spread to others. And there wasn't a whole lot of context or clarification provided at that time. And so we've received a lot of questions in the past 24 hours. If asymptomatic people can't spread this, or at very, very low risk, then why are we wearing masks? And why are we doing many of the things that we've been doing in thought about, or thinking about, this fact that asymptomatic people can be carriers? Well, if they're not, then what does that mean? Well, I think it was a very clumsy headline, a very clumsy way to present information yesterday. It could have been done in a better way, but what they're finding is that people who are asymptomatic and who stay asymptomatic are at very low risk of spreading COVID-19. People who are asymptomatic but then develop symptoms are at a higher risk of spreading the virus during that asymptomatic period. And there are many people who are mildly symptomatic or are symptomatic with conditions that maybe previously weren't recognized as COVID-19 symptoms, things like headache or gastrointestinal stress, that now we're recognizing are part of the symptom profile of this infection. And those symptoms, while present, also suggest that a person is more contagious. So the symptom profile is changing. It's still impossible for an asymptomatic person to know if they're going to develop symptoms at a later time or not. And so with these things in mind, we are still recommending that wearing a mask is the best thing to do with the information, and to be fair, with the limited information that we have about COVID-19 right now. It's a very easy thing to do. We do believe that there's lots of sound scientific reasons to think that it can reduce the amount of virus that a person is projecting into the near atmosphere around them and into the area that is shared by other people. So our public health recommendation continues to be wear a mask, maintain the social distancing, because you may be mildly symptomatic and you don't recognize that you are actually ill, or you may be asymptomatic and about to develop symptoms and therefore also contagious potentially to others. So keep wearing masks, please. We see that the overall mask use, I think, has fallen quite a bit in the past few days. People are starting to get complacent, and that concerns me a little bit. Our numbers continue to go downward, and that's encouraging. But we need to continue to recognize this is a serious threat to all of our health. So I'm Dr. Adam London, Director of the Kent County Health Department, encouraging you to wear masks and to stay positive, stay heroic, and stay healthy. And I'll talk to you again tomorrow. Thank you.